We're talking about septic shock. Recently, Ashley Park, the actress, was public on her social media channels talking about her experience recently hospitalized with septic shock. I think the best way for people to think about this is it's a spectrum of severity from an infection that then progresses to sepsis, that then progresses to septic shock. Basically, with any type of infection, it's usually localized to an area. The kidneys, the bladder, the skin. When it spreads beyond that localized area to the bloodstream, then that produces an overall, we call it a systemic response known as sepsis. When that progresses, for a variety of reasons, either it's not been treated or it's not been treated appropriately, or the person has additional risk factors that place them at higher risk for this type of severe and potentially life-threatening infection. We call it septic shock, which is when there are multiple organ systems involved. Blood pressure tends to be low, heart rate can be elevated, and then you start to see the potential for all organ systems to be impaired or shut down. So that's an ICU care situation and life-threatening. Sepsis, that kind of middle ground, is also a situation where people need to be treated in the hospital, generally with at least one intravenous antibiotic, and aggressive management of that localized infection, if that's appropriate, if it's known. Sometimes it's not known. And it should be noted, while this is always a possible spectrum of severity with any infection, obviously the vast majority of infections do not progress to sepsis or septic shock.